We want to update you now on a story we first brought you Friday. The parents of little Liam Reid, remember him? They're desperately fighting for his vision. He's that young boy. He's got a rare retinal disorder that's causing him to go blind slowly. Surgeons at the Hospital for Sick Children in Toronto have told him his last hope for surgery with a specialist is across the border in Detroit. But the catch is Ontario is refusing to pay for his treatment. Liam's mother, Christina Reid, joins us now live via Skype from her home in Whitby, Ontario. Great to have you here with us. Thanks so much for joining us.
Oh, you're very welcome. It's great to be here.
Liam's story has triggered a lot of outrage amongst people here in this country that can't believe that he is being put through this, as are you.
I can't believe it either. I mean, it's been 3 years, and it's physically, emotionally, it's just been exhausting for our entire family, really.
Where do things stand right now?
Well, right now we still don't have any, I guess, we really don't even have a specific meeting with Minister Matthews. I guess last Thursday we had visited Queen's Park, and Minister Matthews had indicated that she would be willing to speak with us. We did meet her that day, but we're still waiting on confirmation for an exact date that we can go and explain to her our situation and explain to her that the process that she insists is available for folks like us that are looking for out-of-country care. We have to explain to her that this process is not working for us. And in fact, I believe the process is flawed, and it's certainly weighted in favor of the ministry. We've had a number of things that have happened throughout the course of our applications and our eventual appeal and eventual denial that make you kind of shake your head.
Yeah, it seems bureaucracy is putting Liam in real jeopardy with his eyesight. What's the reality facing your son right now?
Well, right now, I mean, we did go ahead and take him to Detroit on our own. So he was able to benefit from that surgery, the surgery that would not have been performed at Sick Kids. So had we not taken him, Liam would not have any vision in that left eye. I think everyone's aware now that as a result of an unsuccessful surgery at Sick Kids in his right eye, he is blind in that eye, and there is no hope. Unfortunately, he may lose that eye altogether, and ultimately, we don't want this to happen to his left eye, so that's why it's so crucial that we continue the monitoring process, that we continue the treatments, if required, for Liam to keep the little vision that we have developed for him as a result of our search and our treatment out of country.
And what are we talking about as far as time? I mean, how much time does he have before the rest of his vision goes?
Well, to be honest, with this disease, right now, it's hard to tell. The most important thing is, as with any disease, I think it can progress at varying degrees with different people. With Liam right now, he seems to have a stable left eye, and this is what we have to maintain. If we leave this eye alone, if we do not monitor it, he very well may lose that vision, and ultimately, the ultimate, I guess, sacrifice would be that he would lose the eye altogether. So this is what we have to keep on top of this. We did miss an April appointment simply because we didn't have the funds available to take him for his evaluation. We did actually apply for out-of-country funding, again, just this past Friday, for an appointment that's coming up July 9th. I'm hoping the ministry has a second look and realizes that, hey, you know what, this child's vitreoretinal surgeon at Sick Kids is indicating nothing more can be done locally. Perhaps he slipped through the cracks last time. There's nothing going to happen locally. We have to fund this child so that we can continue to save his eye, continue to save the vision that has been established in that eye.
What did the health minister say to you? Did you get the indication that she would help? I mean, she has spoken publicly and said it's not really her in her jurisdiction to do something, but I tend to think that she can do a heck of a lot more than she is.
Well, you know, I mean, ministerial intervention in the past, it happens all the time. Yeah. Certainly it can happen here. So for the minister to say that she can't do anything, that's simply, it's not correct. I mean, it's very misleading. We all know that she has the power to do something. I'm trying to explain to Minister Matthews that the experts that she insists that she is relying on, the expert in Liam's case was a cataract specialist. Dr. Kraneman is a cataract specialist. He would never treat a vitreoretinal condition like this. So for the minister to be relying on this cataract specialist, it doesn't really make a heck of a lot of sense because in the real world, Dr. Kraneman would never have treated Liam. So Minister Matthews, yes, has to rely on the experts. However, Dr. Hugh Langley chose Dr. Kraneman to be that expert. So Hugh Langley is the senior medical advisor within the ministry. He basically has been throughout this process with us for 3 years now. He actually enlisted Dr. Kraneman to attend our appeal, which happened in September of 2011. So at the hearing, Dr. Langley was relying on the expert of a cataract specialist to indicate that the treatment was available locally. So I don't know what's happening here, if messages are being crossed, but I mean, I would think that, it was Dr. Langley's duty to find a specialist that perhaps could have performed the surgery if you're going to be accepting this as an expert opinion.
Right. Well, common sense seems to be lacking in this case. So you've filled out the paperwork. You're spending all your own money. How much money are you out of pocket at this point for Liam's treatment?
Well, we were very fortunate to have been able to do some fundraising in the very beginning, so that was a big help. We've spent to date $45,000. The initial fundraising efforts helped way back when, but of course his treatment has been continuing. I mean, basically, he'll need treatment for the rest of his life.
Right.
The happy thing about it is that as Liam gets older and as he's able to basically tolerate an office exam, the cost of treatment goes down significantly from $5,000 twice a year to just about $400 twice a year. So it's pretty, it's peanuts to the ministry, but for a family who is struggling and trying to help their child, it's a lot of money.
It is, and for a ministry that's been accused of mishandling millions, if not billions, yes, you're right. What you're asking for is not a lot. Please keep in touch with us, Christina, and tell us how this battle goes.
Oh, we will for sure. Thanks for having me.
Thank you so much. That is Christina Reid. She is the mother of Liam. She's joining us this morning.